everyone, and welcome. I'm Caitlin Engel. I'm NKF's Program Development Director and also a registered dietitian. And I'm here today with our Chief Medical Officer, Dr. Joseph Vassalotti. He's also a clinical professor at the Icahn School of Medicine at Mount Sinai. Dr. Vassalotti, thank you so much for joining us today. We are here to talk about the new mask guidance from the CDC and what it means for kidney patients. If you have any questions, please go ahead and ask them in the comments. We'll try to get to as many of those questions as we can today. So to start off, Dr. Vassalotti, COVID-19 vaccines are now available, and that's changing the experience of the pandemic for many people. Can you please speak to your thoughts on COVID-19 vaccination for people living with kidney disease?
Great. Well, thank you, and it's wonderful to be here with you today. I think our country's in a much better place than it was than when we last spoke. And today is May 21st, 2021, and a number of things have happened in the last month, I think, that we'll be talking about. On May 5th, there was a study that was published in JAMA that with a small number of kidney transplant and other solid organ transplant recipients, showing that when they tested one type of response to the COVID-19 vaccine, that they had a suboptimal antibody response. That didn't evaluate some of the other types of immunity that the vaccines offer to protect us from COVID-19. And then on May 16th, the CDC came out with a recommendation about when you've been fully vaccinated. That really talked about kind of a returning back to normal. I think one of the things that's very important about what the CDC said is that they did also say in that statement, if you look on the website, and maybe we can send the link, you should, people who have conditions or are taking medications that weaken the immune system should talk to their healthcare professional about the activities, and they may need to keep taking precautions to prevent COVID-19. And that's really why we're here today. And the National Kidney Foundation on May 18th had a press release that we can share with you in the link also, that urges kidney patients to continue masking and social distancing. And that was a little bit of a roundabout way of answering your question, but I just kind of wanted to contextualize why we're here and why we're talking. And, you know, I have to admit, this is a little bit challenging for me. There's a lot of things that we know, and there's a lot of things that we're learning and that we don't know yet. And I'm going to do the best I can to answer your questions. I'm going to always be referring back to your dialysis care team or your transplant care team or your nephrologist. But the most important thing for me to emphasize is that because we know that there are important risks of COVID-19 in terms of severe COVID-19, hospitalization for COVID-19, unfortunately, lack of survival of the COVID-19 for people with kidney disease, people treated with dialysis, people who have a kidney transplant. It's recommended that all kidney patients receive the COVID-19 vaccines, and all health authorities reinforce that, including the CDC, the American Society for Transplantation, the National Kidney Foundation, the American Society of Nephrology, and others. So the vaccine is recommended. It's also been shown to be safe. So safe, will the vaccine hurt me? It looks like for kidney patients, the safety is similar to other patients in the general population so far from what we know. So we think that the vaccines are safe for kidney patients, and there have been some side effects that were recently documented, but the likelihood of those side effects are very rare. And I would say most of the side effects for kidney patients are related, and other patients are related to your response to the vaccine and developing immunity. And then the big challenge is, how do I behave now, and what do I do now that the rest of the country around me is starting to open up and not wear masks indoors. And you may be tempted to participate in activities like that. And I know I haven't eaten inside a restaurant for more than a year, since February of 2020, and I don't plan on doing that. And the other thing I would say is that you have to be aware of your situations. That if you have advanced kidney disease, if you're treated with dialysis, you have a kidney transplant, you want to be more careful. You want to generally wear a mask when you're exposed to others in public. And I think the other thing to emphasize is not only should you pursue vaccination, but you should also talk with your household contacts about becoming vaccinated as well, because you protect them and they protect you when they're vaccinated.
Thank you so much for all of those comments. I think that's really great information. So I think now we can go ahead and just jump into some of the audience questions. I think you covered some of these. I see we have one question from Vishal, who is a kidney transplant patient, and he is asking if he can take the COVID-19 vaccination, which I know you covered, but if you want to just address that for transplant recipients specifically.
Sure. We know that transplant recipients are at increased risk for severe COVID-19. So you should certainly talk with your healthcare team about receiving one of the COVID-19 vaccinations that's available.
That's great. Thank you. And then another question we got, and this is kind of to do with the different information that's coming out about the different types of vaccinations. So there's a patient watching that got the Johnson & Johnson vaccine, and given kind of some of the maybe press about that, concerns that it's maybe doesn't have the same efficacy rate as the other vaccines, we're seeing really good results with those other vaccines. So should this person, are they still protected? Should they consider trying to get one of those other vaccines? What's your recommendation there?
Well, what does fully vaccinated mean? I think it's good to take this moment to just review that. And if you receive the Pfizer or the Moderna vaccine, which requires 2 doses, it's 2 weeks after the second dose. If you receive the J&J vaccine, which is only 1 dose, then it will be 2 weeks after that vaccine. I think it really depends on you and how your individual circumstances and whether you respond to the vaccine or not. I think that you should really probably talk to your healthcare professional about that. But in general, repeat vaccination is something we're thinking about right now, whether you need a booster or maybe you'll need a second dose of J&J. Maybe you'll be recommended to take a different vaccine like a Pfizer or Moderna in the future. But that hasn't really been clearly determined, and we're still learning about that. So there's no official recommendation on a booster for kidney transplant patients, but I think it's certainly something that is being considered.
Thank you.
The other thing I want to say to kidney transplant recipients that's very important is not to change your immunosuppression regimen because you think that'll help you respond to the vaccine. Please work with your transplant care team about the vaccination and when you should receive it, and also regarding any potential changes, and don't make any changes in your immunosuppression.
That's great advice. Thank you. Can you maybe clarify some of the evidence about the efficacy of vaccines for transplant recipients versus someone who's stage 3 or 4 kidney patients? Do they have the same concerns about efficacy, or do we have different recommendations for transplant patients versus other kidney patients?
Thank you for that question. That's important. For patients who have a kidney transplant who receive immunosuppression, or other kidney disease patients who receive immunosuppression, sometimes we use immunosuppression to treat a glomerular disease or a type of kidney disease. Sometimes you may have another disease like rheumatoid arthritis or Crohn's disease that you take immunosuppression for. So we think that patients who have immunosuppression treatment are at increased risk for lack of antibody response. That's what we know so far. We don't know about the cell-mediated immunity. So not only is there the antibody response that was studied recently in that JAMA paper that showed about 46% of the patients didn't respond to the vaccine by the antibody test. It didn't evaluate other types of immunity, cell-mediated immunity, which includes something we call memory B cells and killer T cells. And it's possible that you might have some immunity from cell-mediated immunity and not have the antibody-mediated immunity. But I would say in general, about a 50 to 70% response rate is seen in kidney transplant recipients, with some nuances based on the type of patient. Dialysis patients, people treated with dialysis who don't take immunosuppressive medications, we consider that a type of immunosuppression. It's much more mild and subtle. So dialysis patients may have less of a response than the general public, and we're starting to see that information now. I think it's going to be probably more robust than the kidney transplant recipient. And I think for stage 3 CKD, probably we're thinking that's more like the general public. And one of the reasons in our press release, we said patients with advanced kidney disease, or patients who are approaching kidney failure, kidney transplant recipients, and patients who are treated with dialysis, those are the ones that we're the most concerned about. Earlier stages of kidney disease, probably, although we don't know, we're still learning this too. So we need to collect data, and one of the things the National Kidney Foundation has done is ask the CDC and other investigators to study this more, so we know more about kidney disease patients and their response, so we can provide more guidance to clinicians and patients.
That's helpful to clarify that. Thank you so much. So now we have a number of questions about, the safety of different things after you've been fully vaccinated, especially as a transplant patient. So do you have recommendations as a transplant recipient who's been fully vaccinated? Can they go maskless if they're around other fully vaccinated people? What would be your recommendation there? A friend or two that's fully vaccinated.
Yeah, I think that is something that probably you're best to speak with your transplant care team. I think for me, I would say that's probably a relatively low risk, activity, especially if those are people that you trust or people in your household. That might be something that you decide that, these are friends, but I'm going to have a meeting with them outside, or I'll have a meal or a drink with them outside, a cup of coffee or something. And so that way it will give me a little more protection, a little more safety. I think there's a lot of, gray area, and you have to decide, as an individual, what kind of risk you're willing to take and what kind of risk you're willing to not take. And in general, I think if you have a kidney transplant, I would err on the side of caution. I think it's great that you did receive the vaccine. I'm assuming you're more than 2 weeks after your last dose before you would do anything like that.
Mm-hmm. Thanks. That's helpful. How about a transplant recipient? Sorry, these are all kind of similar, but we'll just go through a couple of scenarios that people are asking about. A kidney transplant recipient who's fully vaccinated. What about being around like young grandchildren who can't get vaccinated yet? Would you recommend that be a masked interaction or not seeing them at all? What are your thoughts?
The first thing to say about this is, of course, discuss this with your transplant care team. The second thing I would say is the Pfizer vaccine was recently authorized for individuals who are 12 to 15, in addition to 16 and above. So if the grandchildren are in that range, 12 years or older, then I think it's reasonable to see if your grandchildren can be vaccinated first before you see them. I think if they're under 12, it's challenging, but I probably would think that many transplant professionals would say to err on the side of caution. I know that's hard to do that, but I think until we know more, and maybe in the future there'll be vaccines for individuals under the age of 12. That may be the better way to go, knowing that there's light at the end of the tunnel, and that we might not have to continue this much longer. But I'm sorry, I know this is hard for you, and it's hard to be separated from people you love, but we want to keep you safe too.
Mm-hmm. Yeah, thank you for that. What about, do you recommend transplant recipients who have been vaccinated get antibody tests to find out if they have, antibody protection? I know you talked about the fact that there's other immune response besides the antibodies that we haven't studied yet, but do you recommend people get an antibody test if they're a transplant recipient? And if yes, how would they go about doing that?
Yeah, I think that would be something you should definitely speak with your transplant care team about. I can tell you that I think the FDA discourages that. I think that there are transplant professionals that I respect highly who don't test patients in similar circumstances because they really don't know exactly what to do with the information at this point. Also, they want to urge caution, and there's concern that if the antibody test comes back positive, that might encourage behavior that was more risky until we know more. If the antibody is negative, what does that, how does that help me? It's partial information about the immune response of the vaccine. And I think the other thing that's so important to say is that there are many different types of antibodies. And these antibodies were designed, many of them were designed to test for previous exposure, previous infection with COVID-19. There's a spike protein antibody, and there is a nucleocapsid protein antibody, for example. And those nucleocapsid antibodies always indicate previous infection and are never positive for people who have the vaccine, which is based on the spike antibody generation. So some of the tests won't be helpful. And other tests are semi-quantitative. They just say positive or negative. So the threshold for positive or negative may not be the same threshold that you need for vaccine safety or vaccine immune response. And we don't know sometimes what titer of the vaccine or what level of antibody is protective. So if you were to get tested, it's important to understand which antibody you tested. It could be the spike antibody, and it's something that should be individualized. We have no recommendations now, and I think it's really something you should discuss with your transplant care team.
Thank you for that. That's helpful. So if you're going to do it, talk to your transplant care team and have them help you interpret those results is kind of your guidance. Dr. Vassalotti, it sounds like some people are having trouble hearing you. So if you can get a little closer to your microphone, that might be helpful. Can you, yeah, thank you. What about a kidney transplant recipient who got the first dose of vaccine but hasn't gotten the second dose? I guess this could be for a non-transplant recipient too. If someone got the first dose but hasn't gotten the second dose, do they start over, or can they just go get the second dose now, even though it's been longer than the recommended time period?
Right. Well, of course, if you receive the J&J, there's only one dose for the J&J. This would be a moot point. if you receive the Pfizer or the Moderna first dose, then you should receive the second dose as soon as you can. If you delayed because you missed the second appointment or you were ill or for some reason, you should, of course, discuss this with your team and also with the place. It's generally recommended that you return to the place where you received your first dose to receive the second dose. So wherever you are, go back there and reschedule an appointment as soon as possible to determine the next steps. But you should certainly at least get a second dose. And you shouldn't consider yourself fully vaccinated. You're partly vaccinated.
Thank you. That's helpful. So this is a good question from the spouse of someone who's a transplant recipient. So they're both fully vaccinated. This person is someone without immunosuppression. So they're a healthy general public individual who's fully vaccinated, but their partner is a transplant recipient who's fully vaccinated. Should that individual continue to follow, the safety precautions that we'd recommend for a transplant recipient, just to, not risk potentially getting infected and bringing that home to their partner? Did I ask that okay? That was a little confusing.
I think that's a really great question, and thank you for asking that. So the question is, if I am healthy, but my spouse has a kidney transplant, I think you should be more careful. Yes, I think it's reasonable for you to be more careful and reasonable for us to ask you to be more careful, because you could become infected and then that would potentially transmit the infection to your spouse. You're definitely much more protected with a vaccine, we think. Depending on which vaccine you got, you have a high level of protection, but we know that it's possible to become infected after receiving the vaccine, much less likely. Much more likely it'll be mild infection, and you may have no symptoms at all. Especially for that reason, it's certainly possible that you could transmit the infection. So I think you can you can probably do things like take the mask off when you're outside, maybe have dinner outside with the mask off. But when it comes to going into places with a lot of people, indoors, I think I'm going to wear a mask. I'm just telling you, I'm not immunosuppressed. I'm going to wear a mask every time I'm inside for any period of time. One of the challenges is we don't know if there's 10 people in the room, who's vaccinated and who's not. I don't know that. You don't know that. So I think it makes sense to be cautious for your spouse. And thank you for asking that. I think that applies to household contacts of kidney transplant recipients in general.
That's helpful. Thank you. And I think you kind of answered this question in your response to the last one, but the question is, can fully vaccinated people still carry COVID or spread it? Yes.
So we know from experiences and healthcare workers and experience in other countries that with large data sets that infection after a vaccination is possible. It tends to be much more mild, much less viral circulation system or detectable virus, much lower risk, and it's not common. So it's the likelihood of that happening is relatively low. But the more chances you take, the more chances you take being exposed to individuals who may be infected, the more likely that is to happen.
Yeah, thank you. Can you speak to any research that's come out about any impact the vaccines might be having on kidney function?
Well, I don't think that we have any safety signals with kidney function. There are case reports of different things happening, but it's where patients developed kidney diseases after, but these are very rare and uncommon. And if you have millions of people receiving a vaccine, the issue is that just a random event that would have happened anyway, and is that or really a safety signal. So it doesn't really appear right now that the vaccine affects kidney function at all. What is clear is if you get COVID-19, your risk of acute kidney injury will be very high, especially if you have kidney disease already or a kidney transplant. And we know that patients who have severe COVID-19 are hospitalized, not only does their kidney function decrease during the hospitalization, they may require dialysis during the hospitalization, they may require dialysis long term after their discharge from the hospital. So it's definitely clear that the COVID-19 infection can impact kidney function. And it appears that the vaccines are safe and do not affect kidney function in the vast majority of the patients.
Thank you. That's helpful to contextualize that. Here's another question about children who are transplant recipients. And my guess is probably this is the discussion with their healthcare professionals. But so it's a 5-year-old child, possibly starting kindergarten in the fall. Is it safe for that child to attend in person? What would be your recommendation about in-person school in general for kids under 12 who are transplant recipients and can't be vaccinated?
Yeah, this is really, really challenging. I think you should check with your transplant care team. You know, of course, you want your child to be in school. It's a better experience for them, especially at that age, that tender age that, you know, but of course, then if they're home with you and they're too young to be vaccinated, you have to deal with that risk. So I think you need to individualize that with your transplant care team. And I'm cautious not to give you any specific advice other than to say this is a really difficult situation.
Yeah, there's a lot of tough choices people are having to make. This person has had both their doses of their Pfizer vaccine and is going on vacation this weekend, potentially including a trip to a casino. Should they wear a mask in the casino? I think, again, this comes back to transplant recipients. How should they behave in large group situations, even if they're post second dose vaccine?
Yes, well, I think you should check with your transplant care team. I think for me, I would probably say if someone asked me that question, I would say no. You know, I would say, can't you take the vacation for a weekend and avoid that trip to the casino? That sounds like a high risk exposure because casinos have lots of people in it. They're going to be unmasked. Maybe there's going to be alcoholic beverages involved. And, you know, I think that I would worry a lot about the casino exposure, and I would try to finesse you to enjoy your weekend without the trip to the casino. But I think, you know, you have your transplant care team and you should see what they say, but that raises a red flag for me at least.
Mm-hmm. Thank you. That's helpful. And then this person is someone with stage 3 kidney disease. They're wondering about their safety going to work with fully vaccinated coworkers who are not wearing masks at work. I'm assuming this person is also fully vaccinated.
Yeah, that's a great question. I think, again, I would probably check with your clinician. I think probably if you have stage 3, you know, we think that you may have a more robust immune response to the vaccine, assuming you're not taking immunosuppression. So it would depend on, are you taking immunosuppression? If the answer is no, and if you're not at an advanced age, or you're not a senior citizen, or maybe you have there may be some decreased response. The older you are, particularly in the very old, I think that that's sort of in a gray area that you know, you would have to discuss with your care team. I think that would be the kind of a judgment call that you could go either way. Is that something maybe, I think if someone asked that to me, I might say, maybe you can try to work remotely for another month or so, or maybe we could have some kind of a compromise here, because it sounds like a reasonable thing that you want to do. But keep in mind, I think as of today, only about half the country has gotten any doses of the vaccine. Only, I think 38% of Americans are fully vaccinated, and it would also depend on where you live. Um, and then I guess, are you absolutely sure that all your coworkers are vaccinated? No. So I think, and in parts of the country that the rates of vaccination vary in states from 1/3 to 2/3. So there's a huge difference depending on where you live, and so understanding your local situation is going to be important too.
Thank you. That's helpful. This person asks a good question that I've heard before. So that they had COVID a few months ago. Do they only need one dose of the Pfizer vaccine, or do they still need 2 doses even if they've already had COVID?
I think if you had previous COVID-19 infection, the official recommendation is still to receive both doses. Some people say that you should wait 90 days after the infection symptoms, because you may have some protection from the infection itself. But that's no official recommendation. So you can be vaccinated immediately after you feel well, or when you feel well, after hospital discharge. The one thing that I didn't mention that I think it's really important to mention about treatment. So if you test positive for COVID-19 and you're a kidney transplant recipient or a dialysis patient, or you have chronic kidney disease of any type, you should contact your clinician immediately as soon as that positive test comes back, or you have the symptoms in a positive test, to pursue whether or not you can receive antibody therapy. So what is this antibody therapy? So there's much talk about antibodies. So most of what I've talked about so far has to do with antibodies in our bloodstream to the spike protein that are in response to the vaccine. They may also develop in response to previous infection. There are 2 combination COVID-19 antibodies that are treatments. They're infusions that are given by vein that should be pursued in people at high risk for severe COVID-19, which includes all kidney patients essentially. And the important thing about that is they need to be given within 10 days of the symptoms. It's for mild to moderate infection. So you would be an outpatient at this time, and it can prevent severe COVID-19. It can prevent hospitalization. And so I think it's very important that you receive one of those 2 FDA authorized combination treatments, and you would have to work through your care team. And as far as which team that which infection preventing or severe infection preventing antibody combination you receive, I would just leave that to the discretion of your care team, and usually the infectious disease professionals will make that decision.
Thank you for that. That's a great recommendation. So I just have 2 more questions, then I think we'll wrap it up. So one, and I think you kind of addressed this, do we expect that a 3rd dose of the vaccine may be required for kidney transplant patients? Is that something that's going to be coming down the road?
Yes, that was one of the conclusions of the JAMA study that I referenced before. One of the potential conclusions is that there will be a booster shot in the future. But will that be the same Pfizer vaccine that you received? Will it be a different vaccine? Will there be a special booster that that's developed in the future? I think, or a different kind of Pfizer vaccine. All that I think is are things that we're still learning, and that we don't have clear recommendations for it. But that's certainly a possibility that will be something that we address in the future. And I think most people are expecting repeat rounds of COVID-19 vaccination will be necessary in the future.
Thank you for that. And this last question, I think this kind of speaks to a lot of these sort of risky things right now for transplant patients. Do you have any estimation of when it might be safe for transplant patients to fly or even to do other, more large group, higher risk activities? Do we have any sense of when that might be a safer activity?
Well, we're still learning a lot about what's happening with COVID-19 in this country. It's clearly getting a lot better. One of the things we're still learning about is how well the vaccines work against the coronavirus variants. It seems like the preliminary data suggests that the vaccines are effective for the most part, but there are still some concerns. And so that's an outstanding question. And the other outstanding question that we're still learning is this so-called population immunity or herd immunity. What level of immunity in the population at large is required to give us mass protection or generalized protection. And I think we would need to be there before most transplant professionals would recommend flying. I think that car travel may be safer and something worth considering offering. And I know that you want to travel now. You've been sheltering for so long, so I definitely sympathize with that sentiment, and hopefully you'll find a way to do it that can minimize your risk.
Thank you for that. I know that these have been tough questions, and we don't want to keep having to tell people they can't do things, but I think, we have to keep trying to be as safe as we can until we learn more about how to protect our transplant recipients, especially. So thank you for all of your advice. Do you have any closing comments for our patients before we wrap up, Dr. Vassalotti?
I think it's worth reading the National Kidney Foundation press release. I think that is I think it's about 2 pages and really should provide some helpful information. I think you should know that we have requested that additional investigation be completed to help us understand some of the questions that were asked today, and that we have more specific guidance for immunosuppressed individuals in the future from the CDC. And I think the CDC did cover immunosuppressed individuals in there when you've been fully vaccinated. But I think there are a lot of nuances, unanswered questions, and details that we need to go through before we can help you continue to be safe. I'm so glad so many of the people who asked questions have already received the vaccine. It's great to hear. We want to keep that going. I think it's in your interest to have your household contacts and people in your community and your friends be vaccinated. I think if you socialize with someone, I think it's a reasonable thing for you to ask them if they've been vaccinated before you decide to go out to dinner with them outside or start to behave in ways that you haven't in the last year. And we're so pleased that we've come this far, and I think that we're getting close to the point where things will start to open up more for maybe even for transplant recipients, but we're just not there yet. And the same applies for dialysis patients, patients with advanced kidney disease. And if you're on dialysis, or if you have a kidney transplant, if you have advanced kidney disease or any kind of kidney disease and you're hesitant about getting the vaccine, please think about, what is it going to take for you to receive the vaccine? We think the risks of severe COVID-19 far outweigh the benefits. We have more and more experience with these vaccines. We're looking forward to, I think these vaccines will be officially fully approved by the FDA soon. So I think that hopefully some of these touch points and more experience, and more than half the country soon will have received least one dose of the vaccine. Hopefully that will help you get comfortable and receive the vaccine. And of course, talk to your transplant care team, your dialysis care team, and your nephrologist about receiving the COVID-19 vaccine.
Thank you for all of that wonderful advice. And I'll just remind everyone watching that in addition to that press release that we put out with some of this guidance around mask wearing and vaccines, we also have a number of other resources around COVID-19 on our website. And I'm pretty sure that link is probably being shared in the comment box right now. Thank you guys all for attending today. If we didn't get to any of your questions, we will answer them directly in the comments in the next couple of days. And in the meantime, just stay safe, stay healthy, and thanks for joining us today.